COVID-19 and vaccination of prisoners. MHA 575, Current Events in Healthcare. Southern Illinois University, February 21, 2021. My name is Vicki Brown. My current event this week revolves around the COVID-19 vaccinations and the decision in Illinois for prisoners to be vaccinated. Some objectives for my presentation today include that I will be giving you a little bit of background information and statistics on the coronavirus. I will also give you some background information on the development of the COVID-19 vaccination and its variations that have already been approved by the FDA. I will talk to you about the development of Illinois' three-phase vaccination plan and revisions made to that. And then we will dive into some ethical concepts and considerations revolving around my current event, COVID vaccinations and prisoners. The coronavirus has caused devastation worldwide with an astronomical total of deaths at 2,403,641 deaths as reported by the World Health Organization. As of today, February 16, 2021, Infection 2020 reports that the United States has seen a total of 27,726,970 reported cases of coronavirus, with 481,657 deaths. According to the Marshall Project, in the prison system alone, as of February 12, 2021, there have been 377,497 prisoners infected with the virus. Of that number, 300,678 have recovered. The majority of the cases were in mid-November through mid-January. There have been 2,400 deaths in the state and federal prison system due to COVID-19, with the majority of them occurring in mid-January. For Illinois, 1 in 4 prisoners have been infected with the virus, bringing the state total as of February 12th to 10,471. Only 86 deaths have been reported in Illinois that were due to COVID-19. The Marshall Project reports that the positivity rate among the prison system in Illinois is 3.1 times higher than that of the state positivity rate overall. Since the first American tested positive with the coronavirus, researchers and developers have worked diligently on the development of a vaccination that will prevent the infection of the virus or lessen the symptoms if infected. Late last fall, Pfizer announced that their vaccine was being sent for emergency approval by the United States Food and Drug Administration. The FDA handed down approval for the vaccine on December 11, 2020, with the Moderna vaccine being approved following after 7 days on December 18, 2020. With limited supply, each state had devised a plan for the distribution of the vaccines to the different counties throughout. For the Pfizer vaccine, citizens 16 and older would be given the initial dose and then receive the second dose being administered 21 days later. According to the Centers of Disease Control and Prevention, the Pfizer vaccine must be stored at a temperature of minus 112 degrees Fahrenheit to minus 76 degrees Fahrenheit. Once thawed, all doses contained in the vial must be used within 5 days or it is no good. The Moderna vaccine was approved for use in the 18 and older category. The second dose of the Moderna vaccine is administered 28 days after the initial dose. These vials must be stored at a temperature of minus 13 degrees Fahrenheit to 5 degrees Fahrenheit, according to CDC guidelines. The vaccine stays good for up to 30 days in a refrigerator if the vial is not punctured. As soon as the government officials knew that progress was being made on the development of a vaccine for the prevention of coronavirus, federal and state leaders were urged to devise a plan for the distribution of the vials and a list prioritizing who gets the shots and when. Such a plan was developed in Illinois through collaboration of the Illinois Department of Public Health, state legislators, and Governor Pritzker. This plan was based off of recommendations guidelines created by the Center for Disease Control and Prevention. It is named the three-phase vaccination plan. The Illinois vaccination plan was developed during the fall of 2020 and rolled out to the public after an announcement had been made that the Pfizer vaccine had been approved by the FDA. The 51-page plan calls for 3 phases of administration, with the first phase containing 3 subphases. Phase 1 includes Phase 1A, Phase 1B, and Phase 1C. Phase 1A is dedicated to healthcare personnel. The vaccines were to be dedicated to the hospital setting, healthcare personnel outside of the hospital setting, healthcare personnel in congregate care settings, and then offered to residents of congregate care settings. With the supply very limited when the first round of vials were distributed, the county where I work was issued 5 vials. 1 vial can provide vaccinations for up to 6 persons, for a total of 30 individuals for the first week of rollout. It was crucial that the vaccines be issued very quickly, with only 5 days allowable outside of the frigid cold temperatures. At my facility, leadership had sent out a survey weeks before the distribution of the first set of vials to see who was interested in receiving the vaccination. Inevitably, it was more than the 30 doses allowed. Staff were put on a list so that no 2 staff members from the same department received the vaccination at the same time, to avoid absences and interruption of care to the patients served. Phase 1B is separated into 2 parts. Part 1 includes persons aged 65 and older, frontline essential workers, and inmates. Part 2 includes persons 16 to 64 who may have high-risk medical conditions. Phase 1C includes other essential workers. Phase 2 included anyone in the phases mentioned previously that had not already received their vaccinations, followed by the rest of the population. Currently, Illinois is in Phase 1B, Part 1 and 2. Initially, inmates were not included in Phase 1, Part 1. The vaccination plan was revised on January 10, 2021, to include them due to the mass breakouts within the prison system in Illinois. In Perry County alone, over 600 prisoners out of 1,800 were infected with the virus. This put a tremendous strain on the small hospitals in the region and forced leaders from all hospitals in the area to collaborate on a plan to handle the influx of patients that could possibly come in. The prison infirmary in Perry County only had the capability of providing oxygen to 2 patients at one time and was already full of prisoners dealing with other health conditions. It was during this time that the majority of hospitals were full, and finding a larger facility to transfer patients to was nearly impossible. It was also during this time that the positivity rate in the county was up to 18%, and the hospitals were already inundated with COVID patients from the community. The hospital where I work is a critical access hospital that has only 17 beds. One wing of 11 beds was set up as a COVID unit, and all other beds were full. The COVID unit remained full for several weeks, with a mix of patients from the community and the prison. Many of the COVID patients were placed on BiPAP machines to aid them in their breathing. Some worsened and were transferred when beds became available, and some died. Of the patients that were transferred, some had to be transferred as far away as Evansville, Indiana, and Springfield, Illinois. With a bit of updated information, according to the Marshall Project, as of 2/19/21, there have been a total of 381,462 prisoners nationwide that have been infected with the coronavirus. The Marshall Project began tracking prison infections in March of 2020, shortly after the pandemic had reached the United States. The Marshall Project reports that the numbers in prisons first peaked in April of 2020 when mass testing was initiated in the prison system. In Illinois alone, there have been 10,532 prisoners infected with the virus, 87 of which have died. The total number of persons incarcerated in Illinois is 76,000, according to the Prison Policy Initiative. The average yearly cost of living for one inmate is between $20,000 and $40,000, according to the Law Dictionary. Costs include the cost of security, health care, operations, administration, support, and rehabilitation programs. The cause-specific mortality rate for inmates in federal and state penitentiaries in Illinois is 114 deaths per 100,000 prisoners. Since the beginning of the pandemic in the United States, 102,791 prison staff workers have become infected with the virus. Of that number, 184 have died. This data is also from the Marshall Project and includes the entire United States. In Illinois, the Marshall Project explains that there have been 4,063 prison staff workers test positive and only one death reported. Back in December, Lardy, Pitcher, and Blakinger reported that states had to submit their vaccine distribution plan to the federal government by Friday, December 4th. At that time, Illinois had not included inmates in the vaccine distribution plan of Phase 1B. According to the authors, prisoners and prison staff have a higher chance of getting infected with the virus due to living in tight quarters, having inadequate medical care, and a high rate of underlying conditions among prisoners. Not only that, but they concede that these areas could serve as incubation centers for the virus to cause further spread to the community. Larder, Pitcher, and Blakinger point out that bioethicist Holly Taylor stated that prisoners should be high priority on the vaccination list purely due to epidemiological reasoning. However, many disagree. Larder, Pitcher, and Blakinger explained that Colorado Governor Jared Polis made a statement that in his view the prisoners should not be put above people who have not committed any crime. In Illinois, Gutowski wrote that Senator Terry Bryant from Southern Illinois has called the decision in Illinois to vaccinate prisoners above those at high risk is unconscionable. Gutowski reported that Senator Bryant stated that there are still residents in assisted living facilities throughout Illinois who have yet to be vaccinated, as outlined in Phase 1A. Gutowski also reported that Senator Bryant stated that she is not saying that the prisoners shouldn't be vaccinated. She is merely saying that the same guidelines should be used with prisoners as they are with the general public. For example, if you are a prisoner under age 65 and have no underlying medical condition, then you should have to wait until Phase 2 just like everyone else. Others, such as the Director of Global Health at Yale University, have called such opinions immoral. Larder, Pitcher, and Blakinger explain that Syed Omar feels that the plan should promote a, quote, laser-focused, unquote, plan on mitigation of the risk of infection and the risk to the public health outcome. For me, this brought up the question, what rights do prisoners have anyway? According to HG Legal Resources, the United States Constitution provides prisoners with some rights that free individuals have and cannot be taken from them. These include the right to humane care, the right to be free from sexual harassment, the right to oppose and criticize the condition of prisons, the right to reasonable accommodations if disabled, the right to health care, both physical and mental, the right to be free from discrimination, and the same First Amendment rights as anyone else. It is the right to health care that vaccination for the COVID-19 virus falls. To give a little perspective on things, the number of persons in Illinois 60 years and older who have tested positive with the coronavirus is 238,659. The total population in this age group for Illinois is 2,040,163. With these figures, the cause-specific mortality rate of COVID-19 among those 60 and older in Illinois is 883 deaths per 100,000 people. Previously, I had said that the cause-specific mortality rate among prisoners in Illinois is 114 deaths per 100,000. So now let's review some ethical terms. There are three major areas in ethics: meta-ethics, normative ethics, and applied ethics. Meta-ethics is a term that is very abstract in nature. Stanford and Connor explain that the study of meta-ethics does not determine what is right and what is wrong. No conclusions are found in this field of study. Instead, deeper thoughts are investigated. Some of the questions that Stanford and Connor explain come to mind when thinking of an ethical dilemma in a meta-ethics view are: what is good or bad? Where do our morals come from? Should morality be decided on a case-by-case basis? Is there only one answer to any given dilemma? Normative ethics is the ethical viewpoint that right and wrong are decided by society. Stanford and Connor explain that the golden rule of do unto others as you would have done unto you falls under the normative ethics area. Within normative ethics, there are three different approaches that can be taken in an ethical decision-making: virtue-based ethics, the consequential approach, and duty-based ethics. Virtue-based ethics is based on personal values with decisions being made in that manner. The consequential approach to normative ethics is one in which decisions are made based on what brings the best outcome. The most commonly used consequential approach is the utilitarian approach. Utilitarian-based ethics suggests that decisions are made based on the option that is the best for the majority, or commonly referred to as the greater good. Duty-based ethics, however, otherwise known as deontology or rights-based ethics, is the final approach within normative ethics. This approach views that there are certain life obligations that should be the primary focus and should be given priority over others. This approach contends that an individual's rights are the most important in decision-making, not the greater good. The final major area within the field of ethics is the applied ethics. Applied ethics insists that an investigation over a debated issue take place. One should consider two things before using applied ethics. One, is the issue controversial? And two, the issue is clearly a moral issue. So where does the issue of my current event fall? If we consider the issue of putting prisoners above the elderly, high risk, from a utilitarian viewpoint, who is the greater good in this case? Is it the elderly, who by far outnumber the number of prisoners and have had a significantly higher death toll from the pandemic? Or is it the prisoner? Or for that matter, is it the population as a whole? Because if prisoners are to be vaccinated before the elderly, we could possibly prevent further community spread. If we view this current event from a duty-based viewpoint, Where is it based on rights? Who wins? After all, it is the right of the elderly to receive the vaccine, but it's also the right of the prisoner to receive health care, and therefore vaccinations fall under that category. From an applied ethics approach, the issue is very controversial, and it is clearly a moral issue. In conclusion, the coronavirus pandemic has caused much controversy throughout the world, from deciding who gets to be put on the ventilator during the peaks of when cases in hospitals were at their highest, to who should get the vaccination first. In both situations, decisions can be made based solely on scientific reasoning or on the basis of the ethical approach taken. I personally feel like prisoners do have the right to be vaccinated, but it should be with the same priority ranking as all other people. Those above 65 should receive the vaccination first, followed by those 16 to 64 who are high risk, and then lastly, those 16 to 64 with no health risks. These priorities should occur concurrently with the rest of the Illinois plan. In this way, we can not only achieve more equity, but the greater good gets the outcome. Hopefully, once there has been nationwide vaccinations of the majority, we will see life return to normal. Thank you for viewing my presentation today.